Catherine mentioned, this is a busy week, and I think we all recognize that tomorrow is Juneteenth Day, which is a very important day locally. It's an important day in our nation, and at the City of Milwaukee, since 2014, we've been observing it as a floating holiday, which allows our residents to celebrate Juneteenth Day if they decide to do so. But we're holding it under very unusual circumstances this year, as I think we all are very, very well aware. And that is that it's still in the midst of this pandemic. And so if people decide that they want to be outside tomorrow, there will be a lot of people outside tomorrow. And that means that the disease can spread very quickly to very many people. And so in the strongest words possible, I ask people to be cautious if they are around and out celebrating Juneteenth Day tomorrow. That means please, please, please maintain 6 feet of distancing, refrain from handshakes or hugs, wear a mask or a cloth covering to protect yourself and to protect other people, and use that hand sanitizer. Again, we do not want to see a spike in COVID positive testing 2 weeks from tomorrow. We do not want to see that. And it's very, very important. And again, I understand the importance of Juneteenth Day, and I understand the importance of Juneteenth Day, particularly with the unrest that we're seeing nationally and locally. But I don't want people to get sick, and I don't want people to get other people sick. So please, please continue to maintain the social distancing that's necessary to maintain your own health and to make sure you don't get other people sick. So at the same time that that's happening, of course, we're planning more webinars. As I mentioned, Tuesday, we had a very productive webinar earlier in the week with some Hispanic leaders. We've had webinars with salon operators, with businesses, with church leaders. And we're going to continue to do this. So we're going to continue to host webinars on safety and best practices. Faith leaders, again, we'll have another one for faith leaders, and childcare webinars will be coming up first, and we'll have more information about that early next week. I also want to report in on the Restart program. That was a program that we were able to use the CARES dollars for. We had set $20 million aside in the hopes that we would be able to help those businesses that wanted to use these federal funds to help them restart their businesses. I'm pleased to report that we have had more than 900 applications that were submitted before Friday's deadline. The businesses are in every part of the city, every aldermanic district, and the review process is underway right now. We're confident that it's just a matter of days before notification and fund transfers will begin. So clearly there is a need for the Restart grants. And to the extent that we have additional dollars, we may be able to look at a second smaller round of grant applications as well. The other program that I want to follow up on that I talked about earlier in the week was our Active Streets program. This is the program that's going to allow our restaurants and bars to branch out, to literally come out onto the sidewalk and into parking spaces. And you can apply online for that program at milwaukee.gov/DPW. As of today, we've had approximately 9 businesses that have started the conversations with our Department of Public Works. We anticipate that that's going to get much, much more traction as the days go on. Another thing that people should understand is we have resumed our parking enforcement, and we encourage people to use MKE Park as a contactless way to pay for parking. Again, so that you can avoid using dollars or change, you can avoid touching the meters as much as possible. MKE Park is our app, which is very, very, very popular. It's a free download for both iPhone and Android devices. It reduces the spread of germs by paying through your personal device rather than having to touch the meter or coins. It actually saves you some money probably. In the past, we made more money when we weren't using this, but we feel that this is such a benefit to our residents and visitors that we want them to take advantage of it. It's available at more than 6,000 parking spaces around the city of Milwaukee. And the fact that it's a contactless payment system reduces COVID-19 exposure for both the people paying for parking and for the city's workforce by reducing physical interactions with the parking meter. So it's a win-win, it's fast, it's easy, and it can be made, the payments can be made safely while remaining in your vehicle. Additionally, users will get parking notifications when their parking is about to expire. So it'll help you avoid those pesky fines for over parking, along with electronic receipts and payment history, is going to be stored directly on your app. So this is a program we've had in effect for about 5 years. It's been very popular. We've had 225,000 unique users, but we think it's a good time to push it again. At this time, we want to make sure that people don't get sick. Finally, I just want to say two things. One, it is Pride Month, and we want people to be supportive of all of our residents, LGBTQ plus residents. It's important that we show respect for all of our residents, and that's something that I'm very proud of in our city. And finally, I want to commend the Supreme Court today for protecting employees from sexual discrimination with their decision earlier this week, as well as with the DACA decision today. So with that, I'll turn it over to the county executive.
Thank you, Mayor Barrett. I want to echo the comments that the Mayor Barrett just put out there. I just want to make sure that we recognize what the Supreme Court did and making sure that we understand that this is also Pride Month. But, you know, tomorrow is Juneteenth, and we're both proud to say that the city and the county will be recognizing this holiday for all of our employees. And given our commitment to racial equity and becoming the healthiest county here in Wisconsin, we must recognize this important day in American history. And so here in Milwaukee County, we will be flying the Juneteenth flag, the Pan-African flag, as well as the Pride flag outside the courthouse starting tomorrow to honor the holidays, to honor those that have made the many sacrifices to push us as Americans forward. And we're extremely thankful to have Dr. Kwaku Smith, who's going to be joining us today to talk about celebrating the rich history and culture of Juneteenth in our African-American community. I also want to thank the National Guard for honoring Mayor Barrett's and my request to close the testing sites at both UMOS and Custer Stadium to make sure that we recognize Juneteenth. And so we want to commend the decision and appreciate all of our partners at the National Guard for making this decision pretty swiftly. And so even though they will be closed on tomorrow, Juneteenth Day, they will resume testing this Saturday, June 20th, from 11 a.m. to 5 p.m. So if you're showing any symptoms, please do not wait for these sites to open up. Please call 211 if you're not feeling well so you can find a location, get an appointment, and get tested right away. All are welcome to these locations regardless of insurance, income, or immigration status. And so we want to make sure that we're taking all the steps we can to mitigate the spread of COVID-19, and we can't stress that enough. The other thing I would like to talk about is earlier this week on Tuesday, we launched the We Care Crew Coalition. So I want to remind folks that on this Saturday, we have an upcoming community bike drive taking place. This will be from 9 to 5 at both Lincoln Park and McGovern Park. So if you have any gently used bikes that you're looking to donate to the community, we will be accepting those donations early in the morning on at both locations. And then later on that afternoon, we'll be giving those bikes out. And so if you're coming to the drive, we want to continue to stress to practice safe practices, which means to wear a mask, practice physical distancing when you come to pick up a bike or drop off a bike. And if you would like more information about that, please visit www.wecaremke.com for more information. I'll also remind folks that, again, Milwaukee County has allocated $10 million of our CARES Act funding to provide eviction prevention, housing acquisition, and mortgage assistance to folks facing housing and financial instability. So if you know anyone who is facing housing insecurities, please have them contact Community Advocates Rental Housing Resource Center. That number is 414-270-4646, or you can visit their website at communityadvocates.net. These resources are available now, and they are going to go quickly. So please, please, please make sure to sign up as soon as you can. We know that many folks have been making phone calls and they may not be getting back in time, but we know that there is a huge demand, and we definitely understand that we're only scratching the surface with what we're doing. That's all that I have for today, and so I will hand it over to Commissioner Kowalik.
Good afternoon. Thanks, County Exec Crowley. Thanks, Mayor Barrett. You both addressed a couple of things that I plan to talk about today. So again, just reiterating the importance of taking some additional precautions to protect yourself from COVID-19. If you happen to be out and about, or if you're working or whatever the case may be, to honor Juneteenth as the holiday as it needs to be. So again, just shouting out the organizations that are taking a step and treating this holiday as any other holiday. So it's our independence. So it should be honored as such, not just 4th of July, but also Juneteenth. So it's very important. So I want to highlight too that there are a number of events that are happening, smaller events across the city and county. One that I want to highlight is on MLK between Center and Right, between 10 a.m. and 3 p.m. Milwaukee Health Services is handing out COVID safety kits to the community. So the Cream City Medical Society will be standing up a variety of booths and handing out those kits, as well as information about COVID-19 prevention and just health in general in our community. So we're very grateful for Dr. Izzard's leadership, both Dr. Izzard's Cream City Medical Society, as well as MHSI. I also want to talk a little bit about the numbers where we're at, because normally Dr. Weston provides that update, but I'm filling in for him today. That's why you see me. But at the county level, we're at almost 10,000 cases. So 9,995 as of right before this broadcast. And then at the city level, we're at 7,977. As far as fatalities, 328 in the county and 225 for the city. So again, we're slowing down the fatality rate, which is great. We definitely want to continue to focus on saving more lives through preventive measures and then other ways of providing enhanced health care so people can survive if they are exposed and fighting COVID-19. We also know that there are these 5 indicators that we're using to kind of guide how we move Milwaukee forward safely. So we have the cases, testing, care, personal protective equipment, and tracing. So I just wanted to just clarify something, because it seems like there's some confusion and some concern based off of this confusion. But testing is based off of 2 things: the number of tests or the positivity rate. So like last week, how there was a movement for the suburban Milwaukee County jurisdictions from phase B to C, the positivity rate was used versus the numbers. So just being clear that it's not and, but it's or. So the number of cases, again, for the city of Milwaukee, our goal is 2,000, not cases, but tests a day, or the positivity rate of being less than 5%. We're teetering about 10%, which is why we were in the yellow. This also means that we were concerned about testing and that causing some concern for our ability to move into phase 4 for the city. With that being said, we're not moving into phase 4 tomorrow. And I noted this earlier this week because we had red in testing earlier last week. So if there's any red out of the 5 indicators during the 14-day period after you move into a new phase, there's no movement. We have to wait an additional 7 days to reassess. So plan on receiving an update on phase 4 next Friday, the 26th. So just clarity behind that so we don't have any confusion. I know everyone's waiting to see how we do. But as the mayor and county exec noted, that it's important to make sure you're protecting yourself from sharing COVID-19 if you happen to be infected with it and you don't have symptoms, or exposing people that might have a harder time fighting it. We want to make sure we're protecting those that are most vulnerable in our population. And lastly, I want to highlight something that will be coming out from the Milwaukee Health Department, and it is a brief about COVID, increasing the number of COVID-19 cases among Hispanic or Latinx individuals under the age of 15 in the city of Milwaukee. So I talked about this a little bit on Tuesday, but this is a formal brief that we are issuing today that will be available on our website, milwaukee.gov/coronavirus, or milwaukee.gov/moving Milwaukee forward safely, or MMFS. Again, that's where we house all of our orders in Spanish and Hmong, as well as English, and the gating criteria table and other supportive documents. So again, thank you, and then happy Juneteenth.
Thank you, Commissioner Kowalik. Now we'll hear from Darren Rausch.
Thank you, Catherine, and welcome everyone this afternoon. I'm Darren Rausch from the City of Greenfield Health Department, and it's my pleasure this week to present the COVID-19 data report from our Epidemiology Intelligence Unit. We've been
We might have lost you, Darren. It appears Darren might have fallen off. So as we wait for him to join, I'll actually hand it over to Dr. Smith.
Thank you. I hope I'll try to stay on this time and whatnot like that. That's the beauty of Zoom. This is live. This is what happens. No, I want to thank you for allowing me to come on. And I come on with great honor, with great pride, but also with the great sadness that we have to talk about Juneteenth in this manner. It was told to me that our own president didn't even know the significance of Juneteenth, and that's why he had celebrated or attempted to have a rally on this day in all places, Tulsa, Oklahoma. But I think it kind of represents our school system and sometimes the way our American history has been sanitized, not to tell the ugly and unwritten history of America sometimes. But the beauty of it is we can get it right. And so with the ability now to talk about what is Juneteenth, this is a day where we talk about America, that no one can be free until we all are free. And on June 19th in 1865 in Galveston, Texas, it was the Union soldiers who were able to come and tell those last individuals who were enslaved wrongly that they were indeed free. And though the Emancipation Proclamation officially allowed those who were enslaved to be free on January 1st, 1863, we know it was not until the completion of the Civil War that these things actually happened. But again, it was June 19th, 1865 in Galveston, Texas, that the last person who was enslaved found out. And as an African-American community, we say no one is free until we all are free. We are absolutely excited that the Juneteenth flag will wave in Milwaukee City, Milwaukee County, and also in the state's capital. I think this is one of those symbolic gestures that leads to great changes that can come. When you look at that Juneteenth flag, it is red, it is blue with a white star, and that white star symbolizes that the last person who's really a part of the United States comes in. But if you can see what the Milwaukee County Executive David Crowley said, it will also go on with the Pan-African flag, which is red, black, and green, which allows us to still hold true to our beautiful African heritage while still holding true to our citizenship of America. So I hope that this becomes an episode for all those who are listening, who are teaching, not just for Black History Month, but to understand the importance of Juneteenth, not only to African Americans, but to Americans everywhere. And I think I was mostly brought on here as a psychologist to talk to people about the multiple pandemics that we go on. We understand about the pandemic of systemic racism. That's something we've dealt with. But we're dealing with a different monster that we haven't dealt with since the Spanish flu in this way with the COVID-19. And we're in around day 97, day 98. And so the people are, what do I do to still survive? Well, we're kind of becoming normalized to this temporary new normal. As Commissioner Kowalik has talked about, says we're moving to different phases. So I tell people dealing with COVID-19 is like being a parent with a new child. You have a baby in the beginning, and soon as you think you know exactly what to do, that baby starts to move just a little bit and it changes. So what I tell people to keep your mental sanity, because sometimes you think you have a system set, you have to make sure you're adjusting with the times, with the reopening phase, and to be ready in case something else happens where we have to do a reclosing. We understand that COVID-19 did a disparity on a lot of our ethnic communities, specifically those in the Black and brown communities. And it talked about some of the things we had. So this is a time where I tell people the three basic things we can do, if we can do, is to monitor our sleep, monitor our exercise, and monitor our diet. If we can do those things, that helps us tremendously on so many different levels. What I also tell people to do is also to take time to do self-care. Sometimes we're going so fast, we're doing so much in this that we forget to take care of ourselves, and we can articulate it, but we don't let it manifest into our actions. And then sometimes for people who are feeling good and you do have extra time, let this be a time of growth. One of the things I love to do is I love to read. So I let this be a time where something I didn't have a chance to do, I become and I get a chance to do. But don't feel guilty if you can't do it. It doesn't have to be with books and reading. It can be just with time that you share with families. We think about some of those earlier months where people were really closed in and some of the great times they had. I say, learn what you can, because the pandemic not only told us what we took for granted, but it told us some things we weren't doing good. So some of the things we're doing in the earlier stages that was actually healthier, continue to put those inside of your life, continue to grow. So as we think about this, I think the best thing you can do, and I'll quote it from my maternal grandmother, Mama Daisy from Chickasaw County, Mississippi. She said, the best way to heal yourself is to help others. So as we see this time of civil unrest, let us all see how we can better ourselves and what we can do to better our community. Because like we said before, no one is free until we all are free. So the best thing we can do to really keep our sanity is to do those basic things of self-care for ourselves, but then look to see how we could be a blessing and a benefit to others. And I'll lead it back to you, Ms. Catherine.
Thank you, Dr. Smith, for that wisdom and those important words to remember during this time of crisis. Darren is back with us, so I'll hand it back to Director Roush.
Yeah, I'm sorry for that technical difficulty. Even though I use Zoom multiple times a day, sometimes you hit the wrong button. So glad to be back. We'll just get into the data. So Jeanette, Dr. Kwolek gave a good overview of the total cases, and we're rapidly approaching 10,000, which is a number I don't think any of us could have imagined 3 months ago when this started. We've been tracking a number of things in our epidemiological report, and one of the things we've been tracking is cases. So here on the screen, you'll see the figure of cases. And again, we are reflecting a downward trend, but as I've said in weeks past, until we're at 0, there is still a risk for disease in our community. So just to orient yourselves to this graph, the yellow bars are daily amount of new cases for the city of Milwaukee. The blue portion of the bars, the daily amount for the suburban communities. The orange line is the 7-day average for the city of Milwaukee in terms of new cases. And the blue line is the 7-day average for the suburban communities. So as we see the data and overall, the cases break down in Milwaukee County, about 1/5 suburban, about 4/5 city of Milwaukee, but it's been varied over the past 3 months, obviously, as we've tracked this. The downward trend is...
Do you want to share your screen so we see the data?
Man, it is not my day with Zoom, is it?
Okay, the green button.
There we go.
Perfect.
So this is the downward trend I was speaking to. So essentially, right around the time we started testing more, we did identify more cases, but we have seen the number of positives go down, and you'll see a little bit later in this data report that the percent positives continue to decrease, and that's one of those key metrics that Dr. Kwolek and others have mentioned in previous briefings. When we look at hospitalizations, or we look at deaths rather, we see a similar downward trend, but the downward trajectory started earlier. So obviously for deaths, we peaked much earlier in April, and we've been kind of on a consistent downward trend, but it's still something we're monitoring. There's a lot of variation in deaths, and these are very small numbers. The peak number of deaths was in early April with 11. So with those small numbers, we'll have more fluctuations, and the trends are a little bit more difficult to see. We've been tracking doubling times in our community because this is an important measure of how fast the disease is growing in our communities. So figure 4 here is reflecting both Wisconsin State in black, Wisconsin County in gray, and the city of Milwaukee in blue. And generally we are increasing doubling times, which means that our case rate is slowing down. Currently, our doubling time in Milwaukee County is 49 days. It's 26 days in the surrounding collar communities, and it's about 28 days for the state. The doubling time is just a little bit less, or a little bit more rather, or a little bit less rather in the city of Milwaukee, but I don't have that number here in front of me today. We've been tracking transmission rate, and this is an important thing to track to kind of monitor how the disease is exploding in our community or not exploding in terms of another way of looking at it. The transmission rate or reproductive number looks at how COVID-19 has been transmitted through our community. Consistently for the past about 3 weeks, we've had that value below 1.0. And this is important because a transmission rate below 1 indicates that we're suppressing that outbreak. So it's very good to see that each positive case of COVID is infecting less than 1 additional person in our community. So that's very good. That shows that things like physical distancing and mask wearing and keeping an awareness of who's around you and where you are has been important to limit the spread of disease. We have tracked a number of demographics, and there are not a lot of significant changes this week from previous weeks, but one of the things we continue to mention is that median income data continues to demonstrate that those in the lowest income quartiles have the greatest COVID disease rates. I've continued to note that the younger case group, so in this case, the 18 to 39-year-olds, continues to have the most cases. But as we heard from Dr. Kowalik earlier this week and earlier today, we've seen recent spikes in cases among those who are under 18. So that's something that we need to continue to monitor. When we look at rates, while the 18 to 39-year-olds may have the most cases, we continue to see the greatest disease rates in those who are older than 80 years old. And that continues the narrative that our older population is the most at risk for disease, hospitalizations, and complications. And not surprisingly, they have the highest rates of death in the county. Our Hispanic population continues over the last 4 weeks to be the leading population subgroup in terms of case rates. Right now, their incidence rates, or the rates of new disease in the Hispanic population in Milwaukee County, are almost 2.5 times that of the next population subgroups, which is the African American and Asian population subgroups. So we continue to see a lot of disease in the Hispanic community. And then lastly, I'm going to skip down to testing coverage because that's something that we've been monitoring quite closely as well. And the data quality this week is much improved over last week. So you'll see here that we're still missing a little bit of data, and we reflect in week 13 that we have some data pending, so that data isn't exactly accurate yet. But the backlog is gone, and we now have a good look at what data has looked like. So we have seen basically that our peak in terms of total testing occurred in week 9, and we've been very steady in terms of testing in weeks 10, 11, and 12. But during that time, our percent positivity has gone down. You see it here on figure 13. You see it even a little bit better when you look at these two figures in 14. We're seeing a downward trend. Not statistically significant this week, but still trending in the right direction. And we know there's some data missing that will change that look for us in the coming days. Lastly, I'll end with our maps. I always like to show a map of what's happened since the beginning of COVID, and this is our rate map of new cases of disease from March 11th to June 16th, and you can see we have disease everywhere in Milwaukee County. The redder areas have been more disproportionately impacted by disease. And then if we look very granularly at what's happened in the last week, looking from June 10th to June 16th, we continue to see a trend that we've seen the last 3 or 4 weeks, a very heavy concentration of positive test results identified in the south side of Milwaukee, the suburban communities in that area, with a few pockets in other areas. You can see some areas of yellow and green here in the northwest side of Milwaukee and up into Brown Deer. So we continue to use this data to reflect, to refine where testing is located, our messaging and education and outreach efforts in our community. And lastly, as I work to hit the right button, I just want to, continue to reinforce that this data is important because it shows that disease is still circulating in Milwaukee County. We still have nearly 100 cases of disease identified in the county every day. I continue to urge you to do your part in limiting distancing, limiting disease spread by physical distancing, staying home when you're ill, and wearing your face mask, not only to protect yourself, but others around you. Thank you very much.
Thank you, Darren. At this point, we just have one question right now, and it's from Tanner Kaler with WISN 12. She asks, Mayor Barrett, what is the status of scooters in the city of Milwaukee? Will any scooter companies be allowed to return to the streets this summer? And is the coronavirus impacting those decisions?
There is a potential that scooters will come back. I know they've come back to Chicago. We're still operating under the pilot program. So we'll get you more information on that to see. I don't have that at my desk here as to the contacts we've had from the scooter companies. I know there are not as many companies interested in being in our market as there were last year. So let me get that update and we'll get that information for you.
Thank you, Mayor Barrett. We do have another question here from Sharon Bagenda with CBS 58, and it is for County Executive and the Mayor. Would there be another stay-at-home order if numbers do get crazy? How is that going to look like a second time around? And are we prepared as the city county to enforce another stay-at-home order?
Well, I'll quickly just jump into there. So unfortunately, Milwaukee County, we don't have a health department, so we can't issue any type of orders. But we are going to continue to look at the data and the science as it relates to how we operate within our facility. It's one of the reasons why we put in place the universal face mask policy. So we are going to be paying attention to that, but we're doing everything that we can within Milwaukee County to mitigate the spread.
And in the city of Milwaukee, we'll continue to follow the science. Commissioner Kwolek has talked about moving from phase to phase. Again, we're in phase 3 right now. We are not going to be moving to phase 4 later this week. And my fervent hope is that we don't get a second wave of this that will require us to take additional actions. But I think one thing we've learned in 2020 is that it's probably impossible to predict anything. But I think all of us hope that we don't have to return to that. But I can't make that as a 100% guarantee. I know in some southern cities, you've seen some backtracking because they moved too quickly and they lifted the restrictions too quickly. And all of a sudden you're seeing very, very sharp increases in places like Texas and Arizona and Florida. We in Milwaukee have been far more measured. And I'm hoping that the fact that we have been following the science and acted more prudently is going to help us in the long run, because we know that in some of those areas where they didn't act prudently, it had some pretty grave consequences.
And Mayor Barrett, you actually touch on Sharon's second part of the question, which is Wisconsin is doing well compared to many southern U.S. states. But health officials on this call have said that the worst is yet to come. Whether it be the electeds or the health officials on this call, the question is, what factors are going to play into making COVID-19 numbers rise?
I think we all recognize that the more people get life back to normal as they saw it and have the interactions, that it can spread much more quickly as a result of that. And that's something that we all want to avoid. So I think that that's clearly one of the factors. But I think the other factors we really don't know. Again, you listen to Dr. Fauci and his comments nationally about how we could certainly have a second wave of this. You see what's happening in the southern states. And so, again, this is not a situation where I'm going to be cocky and say, we got this, we got this. I hope we're headed in the right direction. I know that we're seeing better numbers, but